Hi, I'm Dennis Worsham. I'm the Prevention Division Director here at Public Health Seattle in King County, and it's Public Health Week. So we thought it would be great to bring some of our great stories to you on Facebook Live and share some of our stories of what we think we're doing well here and you should know about. So this is my opportunity to interview one of our top Driz, which we're going to learn a little bit more about here in a moment, Michelle Perry, who's been with us for a little while. So Michelle, tell me something about you.
So I'm Michelle Perry, and I've been working with Seattle King County Public Health since 1998. I've been a disease research and intervention specialist since 2002. And before that, I worked at the clinics and at Cedar Hills Drug Treatment Center. So I got a lot of public health experience before I came here. Mm-hmm. And I've been working with STDs ever since 2002, and mostly I work in, mostly I do follow-up for newly diagnosed HIVs and linkage to care.
All right, so tell me a little bit, like, what does a Driz do?
So we follow up with labs that are reported to public health, with case reports that are reported to public health, and with people that come into our STD clinic, which we are in our STD clinic right now at Harborview. So we follow up with people who test positive for STDs. We help them get their partners tested. We help them get treated. We refer people for ongoing medical care, and encourage people to get tested regularly.
So why is that important?
Well, because a good way to measure your public health is your STD rates, and we want to keep our STD rates low so that it reflects our good public health here in King County.
All right. So I know one of the things that I love about the work that you do every day is that you get to interact with people, you get opportunity to really interrupt that transmission of disease and really keep our community healthy. So you've been here a long time. Mm-hmm. So what have you seen change in the world of HIV or being a Driz, or what things have you noticed?
Yeah, so HIV has changed a lot since I've been here, and it used to be not a great diagnosis for people, and there wasn't a lot we could do about it, but now HIV is a manageable medical condition, and we are treating everyone with HIV right away. We don't wait anymore. We're actually in a position that we can actually end AIDS, because when we treat people with HIV, they don't get AIDS. And we actually even have come a long way with our testing and counseling now. The governor just signed a bill that there's no longer requirements for people to provide counseling when they do testing, so we've come a long way in making HIV testing just part of routine medical care. And this is going to help reduce stigma and just help more people get tested so that they know their status and can stay healthier longer.
Yeah, we had a chance to meet for our first time in our career in the early 2000s, mm-hmm. and really from that time to current, just the hope that we have around this disease and for people living long, healthy lives with that, and really the work that you've done in really helping to prevent other people from getting this is really great. I'm sure you have a ton of stories about success that you've seen, mm-hmm. things you're very proud of, and the work that you've done in the communities that you work with. Is there one that you would want to share?
Yeah, so, well, first of all, I'm really proud of our linkage to care rates in King County. In 2016, we had 87% linkage within the first month of diagnosis. So we're super proud of that here in King County, and we continue to work on it all the time. But there is every once in a while someone who takes a little bit longer to fully get engaged in care, and so I'm super proud of one of my clients that I was sort of persistent in every once in a while reaching out to them. Are you ready? Do you want to get into care? And then we opened our Max clinic here in the STD clinic, which is kind of a walk-in style, low barrier clinic to get people who are out of HIV care more opportunities to get into care. And we invited him to that clinic. I changed my messaging a little bit and told him I had opportunity for him to get into care, and I came in and started engaging with a case manager, and was homeless and drug addicted, and asked for drug treatment, and the case managers worked with him and made some referrals and helped that happen, and got him a bed to inpatient treatment. He went through treatment. He stayed engaged in care the whole time, and I'm very proud of him. He graduated from the Max Clinic. He's in regular HIV care, job, not drug addicted anymore. It's just to be a little part of that happening makes me very proud. And so, I just continue to bug people who are out of care and encourage people that, if they ever want to reach out to me, I'm here to help link people to care.
Yeah, good for you, good for you. High five on that. All right, thank you for joining us on Facebook Live and to hear the wonderful story that Michelle just shared with us about her work, her career, and we're really about interrupting that transmission disease, keeping our community healthy. So thank you for tuning in to Facebook Live, and follow us on Facebook for more public health during this week of Public Health Week.